LSD, or D-lysergic acid diethylamide, has many street names. Below are some of the most common. What is LSD? LSD is one of the most commonly used synthetic hallucinogens. It's manufactured from a lysergic acid compound found in ergot, a fungus that grows on grains. It is a white or clear, odorless, water-soluble crystal that can be crushed into a powder and dissolved. Its most common form is as a liquid that can be transferred onto a small paper square known as a blotter. It can also be dried on gelatin sheets or put into capsules or on sugar cubes. It's commonly laced with other drugs. Because of its high potential for abuse, LSD is currently a Schedule I drug under the Controlled Substances Act of 1970. Albert Hofmann, a Swiss chemist, synthesized LSD in 1938 while searching for pharmaceutically active derivatives of lysergic acid. It wasn't until 1943 that he discovered its psychological effects. By 1947, Sandoz Laboratories introduced LSD as a psychedelic drug, which led to further research in the United States. It takes approximately 30 to 90 minutes after ingestion for a user to feel the effects of LSD. The user's experiences on LSD are known as trips, and they can last anywhere from 6 to 12 hours. LSD causes hallucinogenic effects by disrupting the interaction of the neurotransmitter serotonin and nerve cells. Serotonin is involved in the control of behavioral, perceptual, and regulatory systems, such as mood, hunger, body temperature, sexual behavior, and muscle control. Due to its similarity in structure to serotonin, it activates serotonin 2A receptors, so it fits almost like a key into the serotonin in our body, stimulating serotonin's activity in the prefrontal cortex. The prefrontal cortex controls perception, emotion, and appetite, which are computations that help us interpret reality. The first hour of an LSD trip involves feelings of anxiety, tingling, and nausea, as well as visual impairments such as the appearance of bright colors. The third hour is known as the peak and involves the extreme visual, open and closed-eyed hallucinations. Individuals can experience epiphanies or internal revelations while under the influence of the drug, going from periods of giddiness to extreme insight to feelings of extreme paranoia, especially when put in a situation with people who are not tripping. The most common dangers of LSD result from bad trips, which include terrifying thoughts and feelings of despair, fears of losing control, and even fears of death. These problems are especially common and severe in people with underlying mental problems like severe depression, schizophrenia, or bipolar disease. Problems that might occur include extreme changes in behavior and mood. The person may sit or recline in a trance-like state, experiencing irregular breathing, nausea, increased blood pressure and heart rate, as well as sugar fatigue. Drug-induced psychosis is a form of substance-related disorder where psychosis can be attributed to substance abuse. It occurs when some people, even those with no history or symptoms of psychological disorders, feel the effects of drugs like LSD many years after taking it. The effects could include a distorted ability to recognize reality, think rationally, or communicate with others. Hallucinogen persisting perception disorder, or HPPD, known familiarly to LSD users as flashbacks, are spontaneous, repeated recurrences of some of the sensory distortions originally produced by LSD. The flashback experience may include visual disturbances such as halos or trails attached to moving objects, or seeing false motions in their peripheral vision. In the 1950s, several hundred articles and a handful of books were written about the drug and its effects. It was thought that LSD could help cure behavioral problems like schizophrenia, alcoholism, and many others. By 1965, there were more than 2,000 scientific papers describing the treatment of up to 40,000 patients with psychedelic drugs. Among the more stunning results were from studies in which LSD was used in the treatment of autistic children at UCLA Neuropsychiatric Institute and of chronic alcoholics at Hollywood Hospital in British Columbia and Spring Grove State Hospital in Baltimore. Even some doctors at Emory University took the drug for experimental purposes in order to mimic the symptoms for themselves and gain a deeper understanding of schizophrenia. In the 1960s, the use of LSD spread to recreational and spiritual purposes. With the rise of rock and roll and the counterculture/hippie movement, LSD use continued heavily into the 1970s. Many artists of the time said that they were inspired by the drug or simply took it, such as the Beatles, Jimi Hendrix, and Jerry Garcia. The United States officially banned the drug in 1966, so it remained legal up to that point even though its apparent hallucinogenic effects. LSD gained popularity in the 1990s due to its availability, cheap price, alleged mind-expanding properties, and attractive paper designs. LSD users in the United States tend to be white males ages 12 to 24 years old, according to the National Survey on Drug Use and Health.